These are a few items that are used to create a lower inflection point utilizing a test lung. One is a PEEP valve. This is a non-adjustable PEEP valve, and they used to be made by Vital Signs, but I believe you can get them through Care Fusion. And as you can see, I have a 7.5 centimeters of water PEEP valve. This is the only one I could find. Ideally, you'd want 10 centimeters of water or higher. This creates a better lower inflection point. You need a couple one-way valves, a couple of T-pieces, a 22 millimeter adapter. I believe I only used one, but two's are always better. And some 10 millimeter adapters. I believe they're 10, but they might be 11. So these are common adapters that are readily accessible in many respiratory departments. So they're common adapters, and I believe they're 10. But they could be 11, I'm not sure. And next, some corrugated tubing. So I currently, it looks like I have 1, 2, 3, 4, about 24 inches. You might need more, whatever is more suitable when creating this little loop for your test lung. And now you want to start assembly. You can see that I have my PEEP valve, I have the direction of my flow. So one of the most important things is I want to have my flow go in this direction, so I want my one-way valve to also go in this direction. And I put a T-piece in line. Then you want the final circuit to kind of look like this. As you notice, a couple other things. I have my test lung here. This is an intratracheal catheter, and this is to assess a spirodynamic loop to assess breath by breath my lower inflection point, and as you can see, my ventilator circuit. So that's how I have it set up. And this will create a lower inflection point. Okay, here's my pressure volume loop, and you can see my lower inflection point already. I had to drop my PEEP to 0 to make it stand out. As you can see, I'm getting a lower inflection point without even doing a low flow maneuver because my flow rate's so low. And that's without even dropping my intratracheal catheter. I'm going to go ahead and place it. And as you can see, here is my lower inflection point with my spirodynamics loop.